Good morning, everyone. Thank you for being here for the Agricultural and Human Sciences Fall Seminar Series. Today, it's my pleasure to introduce our third speaker in the series, Dr. Ben Chapman. Dr. Chapman will present food safety in the time of COVID-19. Everything has changed, also nothing has changed. Dr. Chapman serves as professor, university scholar, extension specialist, and department head. He earned his PhD from the University of Guelph. His work is all about designing, implementing, and evaluating food safety strategies, messages, and media from farm to fork. He investigates behaviors and creates interventions aimed at both amateur and professional food handlers, managers, and organizational decision makers. He co-hosts a weekly podcast called Food Safety Talk. He works to promote research-based food safety information through social media. His areas of expertise include consumer, retail, and food safety culture, home food preservation, and communicating food safety risk reduction messages. He is widely published in journals, including the Journal of Food Protection, Food Control, Perspectives in Public Health, and British Food Journal, among others. Please join me in welcoming our speaker, Dr. Ben Chapman.
Thank you so much, Joseph, and thanks both to you, Dr. Donaldson, and Dr. Hardison Moody for inviting me, putting on this seminar series. I think it's really an area that I'm interested in continuing more as our department grows, really just sharing the types of research, extension programs, instructional creativity that our faculty and staff are doing. And so I'm just very excited that you invited me to be part of this first round of this. When Joseph and Annie asked me to deliver a departmental seminar on the things that my program's been working on, it's one of these situations where it got me really excited about many of the things that we still have a lot of problems filling knowledge gaps in the area of food safety. What I'm gonna sort of do over the next 30 minutes or so is give you a sense of what my approach has been, who the Safe Plates team is and what the Safe Plates team does and how it all sort of integrates. And then really talk about the challenges over the last 2 years related to what we do in food safety, and like the title says, how things have really changed, and also how we still have foodborne illness concerns. Those issues from a public health standpoint haven't evaporated with the process of us all going through the pandemic. So first thing I want to do is just give you a sense of I guess where the Safe Plates team program is and where we're going. We have a really from a background standpoint, a really diverse group of individuals who are all really passionate about public health and food safety, who are part of the Safe Plates team. We've got individuals who have conducted PhDs in microbiology and food science, individuals who have focused on areas of science communication. We've got a couple of current students who are split across different departments, co-advised, and here in our department, but are also working in even different colleges as they gain a real multidisciplinary I guess approach to their scholarship. And so everything that I'm going to talk about today, although I'm the one who's invited to give this talk, really this is the team. And there are others who didn't want their pictures included, who we partner with. But right now, the Safe Plates team is about 14 individuals who are doing research, doing extension, conducting social media outreach on a daily basis. And none of what I'm going to talk about would be at all possible without them. That's really where I kind of want to start. The second thing that I want to frame is that all food carries some sort of food safety risk, leads to some potential for a public health illness. And when I say risk, it's really the area that I study and continue to focus on as it relates to my discipline. It's something that I've realized over the last couple of decades that's kind of difficult to communicate. So let me attempt to do so today. Risk is about the potential for a really bad consequence. And it's about the likelihood of that consequence happening, which is a mathematics question, and what the consequence is. So for instance, how many of you, just by a show of hands, either with your video on or just using the emojis as part of Zoom, how many of you have experienced food poisoning? That you would say, I ate something bad, I got sick from it. All right, I'm seeing a lot of hands up. Is everyone, there's a lot, thumbs up. I would say thumbs down, but no. So it's something that I think we all have experienced, and those are the negative consequences. Now let me ask you another question. How many of you have either experienced food poisoning or foodborne illness in a serious enough manner that caused you or someone or someone that a family member or someone that you are one of your friends? How many of you have been sick enough or know somebody who's been sick enough to go to the hospital as a result of foodborne illness? So it's less of us, but it still impacts us. So how many of you, and again, I don't want to put a real negative spin on my seminar today, but how many of you have known someone or have a family member who have gotten sick enough from foodborne illness to die? And I'll raise my hand on this one. And so here's the situation, and I think why it's important to think about food safety as risk. Every day in the US, we eat about 1 billion meals. That's a lot. That's a lot of food. It's a lot of pounds of food that are consumed every day. On average, we have about 10 people in the US who will die every day as a result of food that they consume that tastes totally fine, smells fine, looks fine, wasn't past its expiration date, which is sort of a misnomer. It doesn't really matter, but doesn't have any sort of inkling that it's going to lead to a foodborne illness. We see about 3,000 deaths annually in the US. See about 48 million cases of foodborne illness a year. So about 1 in 6 of you here today will experience, on average, a foodborne illness this year. And somewhere sort of in the middle of that, we'll see, it really depends on the year on this, but we'll see anywhere from 50 to 80 to 200,000 hospitalizations or doctor's trips, public health, primary health care. So the reason why I want to frame it this way is the consequences can be absolutely dire. I mean, fatal. If I worked in the area of home food preservation, And if something goes wrong in canning, the consequence is botulism. Botulism literally is the thing that scares me the most in foodborne illness. Norovirus, which I've probably had multiple times in my life, is terrible. So, it gives you really bad gastrointestinal distress, really watery diarrhea. Sorry if you're all eating your lunch as we talk about this. I apologize. This is the world that I live in. Maybe some projectile vomiting, but you get over it in 48 hours. Botulism, if not treated, leads to death every single time. Even if treated, leads to long-term consequences from paralysis. Most likely, someone who gets botulism will become paralyzed within 48 hours, end up on a ventilator within 72 hours, and may never walk again. And so the consequence of foodborne illness, the problem, or I guess the situation that we live in the world of foodborne illness and food safety, is that we can't predict what the consequence is going to be. We know that like I said, about 10 people will die today from foodborne illness here in the US. So it's really bad, but there are 360 million people in the US that won't die from foodborne illness today. So it's about a calculation, a risk. And everything we do in food safety is about understanding the risk better and trying to reduce those risks. And there are no foods that carry zero risk. Probably the safest foods that we have in the US are commercially canned foods. Pork and beans. In my home, the canned items that we have are things like tomato paste, black beans and refried beans. I'm trying to think what else we eat quite a bit of. I actually, the biggest risk for me in canned goods is that I'm going to cut my hand on a can opener because I can't seem to operate them very well. But they because of the risks of botulism, we actually have federal laws in place that every canned item has to be made in a canned, like commercially canned tinned item, has to be made in a special piece of equipment that someone has to go through federal training, required training on how to use that equipment that has continuous temperature and steam monitoring. So and we used to have a few hundred cases of foodborne illness from canned foods in the US every year. Since the 1970s, we have almost zero, but there's still a tiny, tiny little risk, maybe 1 in a trillion cans could have a problem. So that's the area that I work in, is risk. And the area that the Safe Plates program is all about is understanding risk, communicating about risk, and that there are no absolutes in food safety. So the Safe Plates program, we've spent a lot of time over the last couple of years really visioning who we are and what we do, and thinking about the types of projects that we want to get involved with and our partners. And so we're really fortunate. I'm going to talk a little bit about the Dinah E. Gore Teaching and Research Kitchens in a minute, but we try to do very innovative research. We have the amazing fortune of having innovative facilities. The kitchens that we have access to there's no other facility like them anywhere in the world. There's nothing else quite like what we have built here in our department. Our programs from our education, outreach, and extension programs are evidence-based. We really pride ourselves in the Safe Plates program of generating data to then lead to the extension material that we produce. So we often, and I'll share other research out there, we often work and lean on others for some of the microbiology, but we also do and partner with microbiologists in food bioprocessing, nutrition sciences, College of Vet Medicine here at NC State, and then also elsewhere across the US. And then we really integrate these things. So I wanted to give you the sort of basis of what we do. I'll give you a little bit about our core mission. It's really about being a multidisciplinary group. As I mentioned before, we have people that have different backgrounds, different cultural and ethnic backgrounds, come from different socioeconomic backgrounds to give different perspectives on food safety. But at the core of our mission is that safe food is a right for all individuals, and we really need to focus on how do we move that forward. It doesn't matter that where people buy food. It doesn't matter how they prepare it or how they've been trained or brought up. We are at the core of our mission is that safe food is safe food for all. We're scientists first, and that's something that I think is important. We all have technical backgrounds in some aspects of food safety, food science, food microbiology, but we've moved into these other areas: psychology, sociology, message development, communications, program development and evaluation, health behavior, graphic design. We have all these other tools that we bring into the toolbox to address these issues. And that really, I think, gives us a unique ability to identify questions and try to address them. We see ourselves as a node to go find more out about food safety and push things forward in a way that's maybe not traditional. To give you a sense a little bit about this, I'll talk a little bit about our extension program. And we do a lot of support for agents throughout our state, but also nationally. But we also do a lot of social media and have really forayed into, most recently, into TikTok. And I'll take a little sidestep away from sort of the mission of Safe Plates. This is an area that we've been really only focused on for the last couple of months. And we are, TikTok is a way to certainly, if you've spent any time on TikTok, you can lose hours watching very short videos that are tailored very specifically to the things that you're interested in a somewhat scary way. But we've also found it to be a place where we can connect with people around food safety issues, answer questions, and put out videos that lead to the highest output of any sort of extension related information that we've ever seen. We've just in a couple of months generated, like you can see here, 17,000 followers, but we've had videos that have just within days had well over 300,000 views. And it's an area that, we look at metrics on our website and outreach, and I'll tell you, over the decade that I've been tracking our food safety extension portal, we've never had a year where we've had 100,000 people view our portal. And in 4 days, we had 300,000 people see something on social media related to leftover pizza. And so we explore these new methods. And again, I think the important part for us in this departmental seminar is to sort of share that it's not just a food safety thing. There are applications in youth development, there's applications in other health behaviors, applications certainly in the world of agricultural extension and agricultural education, to be able to utilize different communication methods and messages to engage with our constituents, the consumers, the general public. So we do this in, I show Facebook, we do it in Instagram, but where we really approach this from the Safe Plates Information Center is not to just push information out in a one-way, unidirectional way, but it's really to engage with people, to pose questions, to put out information, but to respond to comments and really generate dialogue around food safety. That's a lot of what we're doing in outreach. We do, but I want to show you and spend a little bit of time talking about our research programs as well. So I went back and looked at, over the last 3 years, who have been the research partners that have funded work that we've done, or have been partners that we have they've allowed us to work with them in their settings. And here's just a snapshot of those logos. Everyone from FDA and USDA to Burger King, Publix, Wegmans, Food Lion, the National Restaurant Association, the North Carolina Restaurant Lodging Association. We really try to engage with constituents on questions that they have that will help make food safer, where people buy food that they're going to prepare at home, where people buy food that they're going to consume. And so I'm going to talk a little bit about some of the research that we've done with these partners, but I just wanted to give you a breadth of, here are the groups that we're working with to try and answer big food safety questions. So, as I mentioned in my title, and as Dr. Donaldson mentioned when he introduced me, what I want to talk about is how things have changed and how things haven't changed over the pandemic. So let me just give you some basics around SARS-CoV-2, the virus that causes COVID-19, and food. On February, I think it was 19th or 20th, 2020, I got a call from the Food Marketing Institute, which is a trade organization that represents grocery stores all throughout the US. And their food safety, their VP of food safety said, we have a problem and we need help. We need help because consumers are coming into grocery stores as they hear about this virus. Again, this is before we had any closures. This is before really I think we had a cluster of illnesses in the Seattle area in the US before certainly we had focused any of our attention on this nationally. The group that represents retail stores said, we're getting calls. We're getting 1,000 calls a day right now about the safety of food, A, that is imported into the US, B, that is exported from China specifically, where we saw the most amount of illnesses, but C, in the Seattle area, people are worried about what to do with their groceries. And so our group here, as the Safe Plates program, started working with virologists internationally to try and answer questions about whether this virus, whether we had any indication that SARS-CoV-2 could be transmitted via food. And so the good news is there had been some work on other viruses, specifically coronaviruses, because of SARS and MERS, two previous respiratory illnesses that we had seen throughout many parts of the world. And there had been a little bit of work on this. The bad news is no one really, and I'll tell you that this is the hardest part about being a scientist in the food safety world, we had not identified SARS-CoV-2 until 9 weeks before this call happened. No one in the US had their hands on SARS-CoV-2 to be able to even walk into a laboratory to evaluate whether it could be transmitted through food. So what we had to do was sort of talk about the uncertainties around the transmission through food, but the certainties about other coronaviruses and how we thought from a genetic standpoint that this virus looked like and acted very similar to those other ones. And so fast forward 18 months, 16 months to 17 months, I guess, to where we are today. We have just a vast amount of data and information that demonstrates that I think fortunately for us, that our informed guesses were that food is not a transmission vehicle, that our internal system, the pH of our stomach, the way that the virus infects us, wants to infect us in our nose primarily, and then in our lungs secondarily, even though it certainly can infect our intestines. It's not the primary mode of infection. And food, fortunately for us, and again, I'll use a joke that I think Sarah Kirby loves the most when I say, and I get to see her face when I say it again, unless you're doing it wrong, we're not putting a lot of food into our nose or lungs. It's we eat food, we consume it, it gets to our esophagus. And so we actually, food, even if there was a lot of virus on it, it's not a really good mode of infection, which is really good news for us. This virus is an airborne, aerosolized virus. That's what we know. That's where well over 99, and I can say this sort of with certainty now that I couldn't say a year and a half ago, but well over 99.99999% of illnesses that we have had are person-to-person infections with people without masks, unvaccinated, being around each other. That's it. That's what we know. Can those virus particles end up on food? Yes. Is food a good, and I'll give you some data on that in a second, is a good source of infection? No. Can the virus particles end up on hands, end up on shopping carts? Yes. We have 2 examples in the last 18 months where we think that fomites, which is the term that we use in the food world and in infectious disease world, where a virus was coughed out, virus particle was coughed out, ended up on an elevator button. Someone came through, touched that elevator button, and then somehow probably inhaled that virus particle, maybe was a factor in an infection. But also in that, what the other factor that existed was that there was shared air with not a lot of air circulation in an elevator. We had 2 individuals who weren't on the elevator at the same time, got sick in New Zealand, and that was the connection. So even things like, and again, I'll get into this on where things have changed and where we're investigating here at NC State and with our partners, even things like cereal boxes, grocery carts. We don't have any data. We don't have any epidemiological link to actual illnesses. Doesn't mean that we shouldn't be cleaning and sanitizing our high touch surfaces, but it's not an area that we've seen actual illnesses come from. But what changed, and again, coming back to what I wanted to share today to Dr. Donaldson's introduction, is that this is a virus that we never knew about before, that didn't exist, that we had to answer questions over the last 18 months very quickly to assure the public that food wasn't a vehicle, to make sure that if it was, that we knew how to protect ourselves. And then really the place that was at the highest risk for us across the entire world over the last 18 months was grocery stores, because we couldn't shut grocery stores down because people, even though we're in the midst of a pandemic, people still need to eat. So we had to figure out a way to manage this virus in those settings. So a couple other things I want to share. Probably the best source of data is colleagues in China who have looked for specifically SARS-CoV-2 on and in food over the last year and a half. They've reported now almost 3 million specimens, packaging, food processing facilities, food itself, and have only found with those 3 million, almost 3 million cases, 22 positive samples. And those samples were positive for PCR, meaning, and I won't get too technical and nerdy here, but I will a little bit, meaning that the virus was there at some point, but what we don't know by testing for PCR in these environments was that it was infectious virus particles, meaning was there an actual risk of transmission? So even at this 22 out of 3 million, you have this really, really low chance that it was even there. But I would hazard a guess that based on all the stuff I told you before, that the likelihood of food, even with these 22, that it was it had the ability to infect somebody is approaching 0. We're talking 1 in a trillion chance. On Friday, colleagues that we work with on a project that I have alluded to here, but I'm going to talk to you about in a second, Food CoVNet, looked at almost 1,000 samples at grocery stores in Canada, published their work on Friday. From those 1,000 samples, they looked at payment, so touchpads, self-service areas, the conveyor belts at a grocery store, deli counter, refrigerated food section. The reason why they looked at refrigerated and frozen foods is we believe that the virus survives better in cold environments. I shouldn't say we believe, we know from data that it's more stable. So we freeze coronaviruses to keep them forever. So frozen virus will stay there for months, maybe years. So if we're going to find it, we're going to find it there. If it's at a hotter temperature, it's less stable. It's more like a day, maybe. It's probably more like 15 or 18 hours. So then carts and baskets, high touch areas. Out of those 1,000 samples, they found 0 SARS-CoV-2 positive samples, which is really, really good. So I think we feel really good about it. Another piece of work I want to show you and talk about is some other groups that we partner with to talk through environmental sampling. They published this last year. It took 23,000 environmental samples in food processing plants here in the US and found about 1.2% that had SARS-CoV-2. And again, not something that was surprising. And again, I want to come back to risk, because what we're talking about and where things changed and where things didn't change, we often look for E. coli 157H7, Salmonella, Listeria in food samples to see if it's there, to calculate what the risk is. But just because the pathogen is there doesn't mean that someone is going to get sick 100% of the time. It's not a one-to-one. There are lots of different factors: our susceptibility, what our immune system is like, age of the individual, what the food is that they consume it in. So even if we've got norovirus in food, it's not 100% of the time that someone's going to get sick. And that's why we try to calculate this out. So even when we looked again here at the height of illness in food processing plants a year and a half ago, or about a year and a half ago, we were still seeing just about 1.2% of samples. So what do we do and where did things change for us? Well, we created this project called FoodCoVNet. We created well over now 130 resources for lots of different stakeholders. They're all available at foodcov.net. We also were able to compete with, I think it was over 250 other applications for a rapid response grant from USDA NIFA last year, where we created a project working with colleagues at University of Florida, Rutgers, and University of Nebraska to not only do outreach and extension in this area, but also do the basic science and applied science on persistence of the virus, transfer of the virus in food environments. And so we're working on that right now. We meet every Monday with our collaborators on FoodCoVNet to talk about the progress that we're making in the laboratory around this. And I'll share with you, we're the leadership group on this here at NC State. But all of the stuff that I mentioned before about the low risk related to food and SARS-CoV-2 is certainly what the data that we're generating and others are generating about this, which is good news. We're lucky to be able to do this project, but I think we're even luckier to say it doesn't. Our assumptions are where we're seeing the data going. Give you a sense of the types of things that we've created. You may have already seen some of these. Fact sheets that we've put out in farmers markets and lots of different food settings all throughout the US and the world. This project is really about generating more knowledge to be able to better answer questions. The last thing I'll tell you about how things have changed is really some of the impacts that we had related to this project last year. If you saw this logo, Count on Me NC, anywhere in North Carolina, I hope you did. This is a program that we created here. We were the technical group. We housed this program. We worked with our state Department of Health and Human Services, the Restaurant Lodging Association, and Visit NC, our tourism board. But we trained over it's now over this number, but as of the end of last fiscal year, 16,000 individuals here in North Carolina on best ways to protect themselves and patrons in restaurants, grocery stores, and other businesses in North Carolina. And so truthfully, out of anything that I've been part of in my career, this has got the most impact, and it's the thing that I'm the most proud of to be part of. And our team being there was really, 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 really great. Okay, so that's how things have changed. A pathogen that didn't exist 18 months ago, we now have an entire research and extension program based around it here at NC State. That was a big difference. How things haven't changed. I want to talk about the Dinah E. Gore teaching and research kitchens, because the area I mentioned before, when I put up all those logos, all the other research and extension that we do is really around pathogens that we've known about for 100, 50, 30 years. And so we're focused on understanding these pathogens more. If you have not had a chance to visit the Dinah E. Gore Teaching and Research Kitchens, please let me know. Love to be able to show. I'd love to show all of you this facility. As I mentioned before, it's something that we do not just food safety research extension training in, but other food related activities, whether that's training our agents. I know the FNEP, Steps to Health teams, do a lot of development of materials and video production, and pushing out information to consumers and their stakeholders out of these kitchens. These pictures do not do it justice. And so please come over and see our facilities. Before I skip forward, let me go back. The picture here on the left is our legacy kitchen, where we do a lot of demonstrations and trainings out of. But on the right, we have 3 kitchens that are set up similar to what you would expect in a consumer home, with 8 different camera angles, so we can view what consumers do or what food service individuals do around food safety. And we have an observation room, this picture here on the right, where in real time, we can view how someone is handling food, whether they use a thermometer, how they decide how big of a portion it should be, how they're cooking and preparing different foods, how they're handling knives, whether they're cleaning and sanitizing. And all of those pieces have gone into the research that we do, that in turn informs the messages that we developed and share with our partners. So to give you a sense of the first year of what we did in the Dinah E. Gore Teaching and Research Kitchens, over 940 observations, 946 hours of data that was collected, recording 79 hours of photography, video and photography production as it relates to outreach that we do, and developing recipes, 122 hours. We're using this facility day in and day out. So how things didn't change as part of research restart that we went through last year at the university. In June, we returned to our kitchens. Even in, when things shut down for us in March 2020, the first thing that we did as a department in going back was to utilize our kitchens in a safe way, because it's an area that we need to continue to do our research and outreach in. So again, I'll share one more example here of the types of things and data that we generate. And just to give you some screenshots of the types of things that we see. In a project that we did for the U.S. Department of Agriculture's Food Safety and Inspection Service on consumer food handling, we recruited and observed 300 individuals from our community here in the Raleigh area who self-described them, were self-described poultry washers. These are individuals that when they purchase or prepare poultry, they remove it from the packaging and they rinse or wash that poultry for a variety of different reasons, cultural reasons, reasons that are related to how they were brought up and taught, what the recipe tells them to do. But on the food safety side, we know that rinsing or washing poultry can only increase risk. It never decreases the risk of foodborne illness, because washing and rinsing doesn't actually remove foodborne pathogens. It only it only really deposits them and spreads them around. But we knew that from laboratory work. So we did the project funded by the federal government to understand more about these risks and understand more about how people wash their poultry. And so you can see here that 85% of our participants rinsed poultry in the sink under running water. But that left 15%, which is a big proportion. I told you a lot of what we do in food safety is about numbers, and denominators matter. So that means 15% of others are doing something different. They might submerge, they might fill the sink up and submerge it. They might submerge water or chicken pieces or a whole chicken into a bowl or a large container. They might add some sort of vinegar. They might do things in a variety of different ways, using the spray wand, there are lots of different ways that people do it. And our research is all about trying to understand more so we can characterize those risks. But what we found, which was probably the most important, was that of 26%, so a quarter of the participants that washed their poultry, we put on this poultry a surrogate microorganism. So basically bacteria that represents Salmonella or Campylobacter that we would expect to see on poultry. Of the people that came through our study that washed their poultry, a quarter of them, as they prepared their meal, we were able to find the surrogate that we added that only could be from us, because it's a lab-based, it's not like a bacteria that occurs naturally in the environment. It's got this fluorescent tag on it. So as it grows, we know we're the only place that it came from. A quarter of our participants who washed their poultry, we were able to recover that bacteria that we added in salad that they would have served to their family if they were preparing in a way that they would normally at home. And so this cross-contamination, that's the area that we work on. How did it get there? Well, of the participants who washed their poultry, 60%, over half, well over half, still had the bacteria that we put on the chicken in the sink after washing and rinsing the poultry. So it was there. 14% of those still had the surrogate in their sinks after they attempted to clean the sink. So meaning there's a lot of cross-contamination, there's a lot of contamination that happens from this. And we would never know this, like I can't stress enough that this is data that could not be generated without the types of facility that we have here in the Dinah Igor teaching and research kitchens. The last thing I'll show you is another project that we did. Again, this is anytime you get a weird picture of yourself wearing Google glasses or the likes, you take an advantage of that. So we also conducted a study on behalf of the federal government to look at eye tracking, to get a sense of during meal preparation, where people are looking. And pre-meal preparation, if you give them cooking instructions, manufacturers' cooking instructions on a box, anything like that, where do they focus their eyes and what do they look at? What does that look like? We get a sense here on the right side in this tablet where someone is actually focused during meal preparation. This research helps us understand what messages resonate, where people look, and helps us understand what they see and what they're focused on. And it generates data like this. When it comes to marketing material or labels, we can see what words, what things people are focused on, so we can adjust those types of messages to make better messages. And again, at the start of this, I said, what has changed? Well, SARS-CoV-2 changed what we were focused on. What hasn't changed is the Safe Plates team focus on understanding more about what people are doing for food safety and how to manage it. I will say before I end here and answer questions, the work that we've done and our partners have done have led to a change in policy, change in messages. So we've been able to change the food code, the rules that regulate restaurants, around things like cleaning up, you know, after people vomit in a restaurant facility in the kitchens. We because of the work that we've done on other projects, we've been able to change the law on what's required in cleanup and training and management. We're in the midst of changing messages at the federal government through foodsafety.gov based on the data that was generated here in our program. So the other thing when it comes to these messages, that we really, it's in process right now, but and I wish I'd put a picture of this, but every meat and poultry package that you look at that has existed in the US since 1996 has safe handling instructions that if you saw it, you would recognize. It's got like a dial thermometer on it. It's got a little hand washing message. They're really antiquated, and the work that we did in our kitchens and across the country as part of our projects will lead to an update of those safe handling instructions that'll be on literally tens of millions of food packages every year. And so I think about impacts out of the Safe Plates program and what we do here at NC State in general. If we think about sort of the think and do aspect of NC State, the Safe Plates program is really at the center of that, of how do we understand more about behaviors and what do we do about it? How can we actually change those? And so I'm extremely proud of the work that the entire team that I mentioned and showed before has done, and the other members of the team that have been here and graduated through the program that have left to go on to do other things. I really appreciate Annie and Joseph, you invited me to be part of this, because this is a story that we don't get to tell internally a lot. We get to tell it to our external stakeholders and really talk nationally and internationally about it, but we don't really share this internally all that much. And so I just appreciate the time to be able to do so today. So I'm happy. I think we've got about 10 minutes maybe left in our time. Joseph, is that correct?
Yes, that's correct.
So, and I'm happy to take any questions. I'll stop sharing my screen now. We can go on gallery mode and can see each other better, but I'd love to take any questions. Feel free to turn your mics on, turn your cameras on, post it in chat, do whatever. I'm very flexible. So anyway.
I've got a question, if it's okay to start.
Absolutely. Go ahead, Jackie.
So your presentation is very timely because you hit on a hot button issue about the washing the meat. And ironically, I was doing a site visit yesterday out in a very rural county in North Carolina with two workers who worked for many years at Purdue, a chicken processing plant. And even though they may have known that you are not supposed to wash your meat, they were very adamant that that was a behavior that they did not want to stop doing. And I know that some of it is just from being in the plant, and they were very adamant that they were not going to stop doing that. So I'm just curious to hear your feedback about that, because in some areas that is a hot button issue. And it's just ironic that I heard that yesterday and then hear your response today.
Yeah, and I think this is one of the things when it comes to health promotion and public health messaging. We know whether it's smoking, whether it's nutrition, obesity, as it relates to exercise, diet, all the things that we want to focus on in public health. Even, talk about COVID management. Once people get into a mindset of beliefs, it's really hard to change those beliefs. And it's really hard to change those behaviors. And so what our research really demonstrated to me is that, okay, and I'll use a a safe sex analogy here. Abstinence probably is not always the best, I'll put all of our eggs in one basket, because people are going to continue the behavior. So what can we do with the behavior that reduces risk after the behavior? And to me, and this is where we got FDA or USDA to really adopt new messages. It's about cleaning. If you're going to go ahead and wash poultry because you think it's doing something, okay, clean and sanitize your sink, meaning wash it with soap and use bleach or quat sanitizer afterwards to get rid of the pathogens that you just deposited in your sink. And so this is part of the sort of impactful side of things. That was a message that foodsafety.gov didn't have until our project came out. They were really focused on just telling people, don't wash your chicken, don't wash your poultry. That's still a message that we want to put out there. But if they are, well, here's what you can do to reduce your risk. If that's something you, and just know that absolutely you're increasing risks. You got to reduce that risk somewhere, and cleaning and sanitizing that sink around that sink really matters. And I kind of skipped over this, but the reason why we see contamination in salad, well, actually, let me ask, why do you think we saw 26% of the salad contaminated after? So they washed their poultry and then made salad afterwards. How do you think it got there?
Maybe improper hand washing, or the water splashed onto the counter.
What, all of it, improper hand washing. So we saw a lot of improper hand washing. I'll tell you where the most likely thing, my guess, and Jackie, you alluded to it, what we saw was people who use colanders, they might rinse their lettuce before that splashing in your sink. Our sinks are a food preparation zone. They just are. People use them all the time. This is an area that until our research, it's not something I thought of in the same way, but water bouncing from that basin up through the colander, leading to cross contamination, is one of the things that we think is happening. So how do I stop that? Well, before I make my salad, if I can clean and sanitize my sink basin, I'm really going to do a lot to reduce my risk. Hope that answers your question.
Dr. Chapman, this is Guy Holly in Invertee, where the potential plant might be at. Quick question for you. I am actually doing a lot of youth programming around food and nutrition, and I would like to be able to bring my youth to be able to see the pathogens and cross-contamination, because that's one portion that I do cover in all of my programs. How do I go about scheduling that and following, 4-H protocols on how many we can travel with and all that jazz once that's squared away?
Yeah. Scheduling wise, I would work with Catherine Hill. I'm not sure if Catherine's on here. Oh, I see Catherine. I'm not sure if that's Catherine. But anyway, we have a kitchen manager, Catherine Hill, who manages our entire Dinah E. Gore teaching and research kitchens. And so if you want to reach out to me, I can put you in contact with Catherine. And certainly we can make sure that some of the folks from the Safe Plates team could be there, but also to schedule a time with the FNAP and Steph's the health team, just about the programs that we do have within the department as you make a visit. But we entertain tours all the time. Right now we have a limit of 10 individuals in the kitchens at one time, so that certainly limits our ability for tours. Hopefully, as we move forward, in upcoming months, we'll be able to expand that, but that's where our limit is right now.
Okay, thank you.
Thanks, Guy. Other questions?
Hi, Ben. I'll ask you a quick question. All this COVID, SARS, and count on us and count on you and count on Ben, all that good stuff really has taken another direction. And I'm really proud that you've been able to spearhead that up. What did it maybe pull you away from? Like, what is your next thing you're working on? What do you see as maybe your new next thing?
That's a great. So, Jane, there's a lot of stuff going on in the Safe Plates program, sort of at all times. Like I mentioned before, we have constant projects that we're doing, and it changes based on need. Right now, we're doing some work with Gojo, the folks that manufacture Purell, on hand sanitizer use in lieu of hand washing, which seems real blasphemous when you talk about it in the world of public health. But what we're really doing is working to answer public health research questions to see what are the impacts. If we know that hand washing compliance is really low, what if we added a hand sanitizing step? What if we supplemented hand washing with sanitizing in the real world? And so we've just conducted 2 phases of research with them, with that, not with them, but they funded with local food handlers, commercial food handlers, to understand behaviors a little bit and the science and establish sort of baseline. We're doing a lot of temperature monitoring stuff. We've got a couple of projects with folks like Instacart and temperature monitoring companies, one called Barcode and another called Testo, to understand food delivery systems. So whether that's like Blue Apron or Instacart, how temperatures are monitored. So we're trying to understand real world situations. We've got Ellen Shoemaker, who joined our team recently. She and I worked together on a project when she was at RTI, and that she brought here to NC State to look at virtual and augmented reality training for farmers and farmers market vendors around food safety. And so we continue with that project. I think like things like ghost kitchens. So it's an area where over the course of the pandemic, how we get food has changed, and I think it'll continue to change. So for instance, there are in Raleigh, in the Triangle, there's an estimated 200 restaurants that don't have a storefront, that don't have a food truck, that exist out of a congregated food space that you can't go to. But they exist in that space with 6 or 8 other restaurants. And chain restaurants and other small independent restaurants are exploring that as a way to reduce their overhead, because people are buying food on delivery way more than they were 18 months ago. And it was happening a little bit before, but the pandemic certainly accelerated it. So there are risks associated with having, 12 different kitchens that have common staff from an allergy cross-contact standpoint, from a sanitation standpoint. So we're working to understand a little bit more in that area. And then one thing I think is really exciting are the Safe Plates extension and outreach team has really started integrating a lot with our research group on trying to answer consumer facing questions like, is it safe to cook food in a dishwasher? Is it, the adage of, if you put, we have a lot of power outages in our state. So what are the best ways to monitor temperature when the power goes out in a refrigerator? The idea of like, can you put a coin on top of a frozen, water, and if it melts, then that tells you we don't, like, that's all kind of like, an urban myth, maybe a legend, we just don't know. So I think areas that we're focused on are those. We're doing a project, and I guess internationally as well right now with colleagues at Purdue University for Walmart China on really like understanding behaviors in other countries and how they differ, but really trying to support like educational programs for food facilities, specifically in China, but in other areas as well. So I don't think, like, truthfully, Jane, to answer your question, I don't think, SARS-CoV-2 took us away from anything at all. It was a need that we had to focus on because, we're in the middle of a pandemic, and the food industry and regulators and consumers rely on us in extension and especially our group to answer these questions. So it was not only part of where we needed to be, it was the most important place for us over 18 months.
Dr. Chapman, thank you very much for being with us today. I learned a lot, and I know everyone else did as well. Also, thanks to all of our audience members for being with us. A quick commercial. We look forward to seeing all of you on November 16th at 11:45 for the close of our Fall Agricultural and Human Sciences Seminar Series. We will hear from Dr. Jay Gerotny, who will describe the use of the Delphi technique in exploring research interest lessons learned. Also, we look forward to seeing you on November 3rd at noon when Dr. Mohammed Gholam Farouk will present Building Bridges Between NC State and Bangladesh Agricultural University through Academic and Research Collaborations. This is part of the CALS International SAGE Seminar Series. Again, thank you, Dr. Chapman. Thank you all for being here. Have a great week.
Thank you.